Well, good day, everyone, wherever you are about the world. We would like to remind you to put your name and country in the chat box if you have not already done that. It's helpful for us to know where you're coming from. And again, welcome. Hopefully, you all know a little bit about the Workplace Health Without Borders, or WHWB, as we constantly call that. It's a nonprofit out of Canada that focuses on worker health and disease prevention in the workplace. So we try to bring these webinars to you to help you protect workers. So with that, we are going to have questions afterwards. You're also welcome to put your questions in the chat box, and we will try to answer those at the end of this presentation. And with that, I'm going to turn this over to Dr. Mary O'Reilly to introduce our speaker. Thank you, Mary.
Thank you, Jen. Thank you, Marianne. And welcome to everyone. It's so wonderful to see all of you. And I will start with just a little background before I introduce Dr. Sefakor Komabu Tomei. It was Hope Windle from the State University of New York through the collaborative online international learning project that introduced Dr. Sefakor to myself and Dr. Hin in Hanoi. And we started meeting in January of this year and had some very, very wonderful conversations. And I do believe Dr. Hin and Dr. Sefakor have done some co-teaching together since that introduction. But I really can't say enough about Dr. Sefakor and all the wonderful work she has done and is doing. She is on the faculty of the State University of Vermont, and she is the director of intercultural exchange in the School of Nursing. She is a disability rights advocate, both for disabilities that are seen and those that are not seen, which is such an important perspective that Dr. brings to this discussion. She has recently published a book which is called I'm Able. You can find it online, and that is something you might want to explore. But I just feel very honored to have the privilege of introducing Dr. Sefakor. And Dr. Sefakor, we are all waiting to hear your message. Thank you so much for preparing this webinar for us.
Thank you so much, Mary, for such a wonderful introduction. Good morning from Vermont, and everywhere that you are, I greet everyone. But I just woke up. It's 10:09 in Vermont right now. Thank you so much. So quickly, I will just start sharing my screen so that we start the fun discussion. Our topic of discussion today is embracing and owning mental health as an invisible disability in our workplaces. And I'm so excited to be with you all here. Gratitude to all of you, especially Workplace Without Borders, and you who is with me here today. I know we have other important programs or events to attend, but this means a lot to us. So I don't take your presence here for granted. I want to acknowledge your presence with me. If you are if you are here, you want to learn a little bit about me and also what I do. So I come to this discussion with three different experiences my personal experience as a person with disability, my professional experience, and my academic experience. And if you don't see me in the classroom or platforms like this doing my professional work, you will see me on the streets advocating for the rights of underprivileged across any category that we advocate for. I put my fan picture here for you to know I like taking pictures. So if I am not on the street also, maybe I'll be modeling with my family members to take me pictures, and I'll be doing designs, styles here and there. Maybe I'll be in the sea because I'm very close to the sea from Ghana, the Atlantic Ocean. When I open my grandmother's window, I see the sea roaring. And as you can see, I'm in Vermont, but I'm still thinking that I'm close to the sea right now. Anyway, so that's a little about me. I have a lot of discussion with us today. This is my overview. I will walk us through. As an African, I have an African proverb to just give you to be thinking about, and we will run through that and see how this will land us. And exactly that will lead us to what is disability. I know that question is a very important question for everyone. We asked it on the flyer, and I know you are all, I have a lot to discuss here. Everything that you see on the flyer is what we are going to discuss. So this is the overview that we are going to go through. Disclaimer. So, what I am, as you have heard from Dr. Mary O'Reilly, is what I am. Internationally recognized disability rights advocate, a researcher, policy analyst. But what I am not is I'm not a doctor, a psychiatric doctor, or any other thing. So I'm a mental health first aider, certified. What we don't do is we do not diagnose or treat ourselves, and we observe changes in behaviors, offer a non-judgmental listening ear. We respect the privacy of the person that we are working with, serve as a vital link to early intervention, and respect and honor the individual's background and experiences. And in my work at UVM, or the University of Vermont, I work closely as the Director of Intercultural Excellence. I work closely with faculty on any issue across. I mean, my office is open. I solve all the unseen problems, and I organize workshops, trainings like this, and also for staff and also students, as I also teach in the classroom. But what I am is mental health first aider, especially to put that out there. So that's disclaimer. So this is the wise saying that I have for you. If you have an hour to chop a stack of wood, spend the first half hour sharpening your axe. Are you sharpening your axe? So sharpen your axe, because this type of conversation is very hard at times, and I would love it for more questions when when I end this presentation, to decode what disability actually means. As much as this discussion is, I want to say that everybody on this platform is going to be a disability change agent or a mental health ambassador. Those are the words that I use for my trainees. And yeah, here I can assure myself that I have an employer or an employee here. And why this matters to me is, one, our belief systems influence our health decisions every day. The different communities that we have different norms about health that also impact us, right? So here I am from Ghana, where mental health or disability is frowned upon. When you read my book, you will know what disability actually means to Ghanaians, or maybe I would say without shame, that Africans and even in the European countries, right? So I have actually schooled halfway through to my first degree in Ghana and went to Denmark to school there. And then here I am in the US and also, working. I have seen disability cutting across all this region having negative connotation. Nobody knows why, but we know that ableist has formed structures. There are systems that have been laid down. And then that is where you and I are coming from today to see how can we decode or dismantle all these things that are part of the system that we have embraced for a long time and which is making our work very hard. So as first aiders, the more we keep in mind, the better we can support others. What we want to talk about or what we want to work with you is your culture is also very important, and how you understand mental health or what name you give to disability. So, what is disability? I made it very simple, as much as the UNCRPD, that is the United Nations Convention on the Rights of People with Disabilities, define the African Protocol and the Americans with Disability Act. And maybe as I work with my organization, EEPD Africa, or that is in short, or enlightening and empowering people with disabilities in Africa, one major thing that we all agree with from the international level to the local level is disability is just a condition. It's just a condition caused by anything, an accident, trauma, genetics, or disease, which may limit a person's mobility, hearing, vision, speech, or mental function. The question that I asked even the president is, would you dare to tell me that you don't have one of this as you are looking at this simple definition? That you don't have one of these? No. So I want this to sink a little. So what the question is, why do we think about people with disability being those small group of people that are so small? So this is it. Whether we like it or not, disability is an accident. If you have anything in your life right now, it could be diabetes, it's invisible, dyslexia. I, for instance, I have dyscalculia. You cannot see it in my beautiful face. But I didn't even know it. In some of our cultures, we don't even have names for the disabilities that we have. That's the reality on the ground. I got to my master's degree level before I got to know what I was suffering from was called dyscalculia, because when it was time for mathematics, I'll be crying. Not that I meant to cry. My question is, what has alphabet got to do with what? Numbers together. A minus Y plus X. That's my problem, but I didn't even know the name of it. So here we are as an employer, as an employee. If, for instance, all of us understand disability as anything that is making us non-functional, at some point, disability will become part of humanity. Simply, let's agree that we deny ourselves from that acceptance level, because that is the place that when you want to kill yourself, you deny yourself that you don't have disability. That is the biggest challenge everybody is having across the world. When you deny yourself, let's assume that we all deny ourselves right now that, oh no, I don't belong to that group. I want to challenge you again as an employer, also as an employee, that you have trauma. Research shows that trauma in 2019 came unexpectedly for all of us. That was COVID. And we are still figuring that out, right? Are you there with me? So let's say you have accepted lightly that, okay, you witnessed trauma. And for instance, some of us, we have childhood trauma. A little bit about that is when I got 8 years in my childhood, I did everything till 8 years. When I got polio, my father ran away, that I became a cursed object. I became an evil thing in the family. And that was childhood trauma for me. I was living with that for a long time. That everything that was in my mind was like, oh, I'm useless. I'm negative. I'm the problem in the house. Anything negative happening in my family. That is what we carry to our workplaces, even as we grow old. Some of you, as you are here, you can connect with that. Now, research shows that 1.3 billion people experience significant disabilities everywhere. And this represents that's 16% of the world's population, or let's say as much as we are, I don't know, we are over 150 here, but 1 out of 6 of us has one disability or the other, or you can have multiple disabilities. And globally, 1.2 billion people live with a mental health condition or disorder. That's huge. That is research. But I am challenging you and I today from the definition that this basically is a data that we are all connecting from. Right now, we are working, when I say we, my organization, working with NGOs across to see how we can connect with data, because we don't have data about ourselves in our home countries. We always link with WHO or World Report to get to all those data. Now, what is mental health? We know about disability, which is anything that makes us not function, which we have one at least. If not disease, it will be trauma or genetics, which I know we have a leverage right now that when you doubt all those, you have trauma from COVID. Now, mental health is just a state of well-being which an individual realizes their own capabilities, right? And they can cope with the normal stresses of life. And they can work productively, can contribute to the community. Where you and I are now, we can say that we are in a very good state of mental health. When we come down to invisible disability, I'm trying to break this down because we are heading somewhere that I will check your pulse, how this is reflecting in your system, right? Invisible disability also is an umbrella term that refers to disability that cannot be seen by others and interferes with day-to-day functioning, but does not have a physical manifestation. That's also invisible disability. And the question is, do you have something that people cannot see out, but you know, within you, you just know that there is something that prevents you from functioning to do something? Is it arthritis? Is it, at the workplace? Is it something that you know that it is happening, especially you don't have a name for it? And because you don't have a name for it, you are likely not able to actually tell people, your employer, to have what we call reasonable accommodation or to have any support system. There are a lot of support systems that are out there, or some we come out with it ourselves because we are not homogeneous. We have different needs. But here lies the case. As I said earlier on, the ably structured systems, policies, practices made it so complex for us that you cannot say you are having something like that because it already has a lot of stigma or challenges. Now, when we talk about mental health challenge, is when there is a major change in a person's thinking, feeling, or behavior. Let that sink. When there is a major change, we do see those things ourselves, at times in our employees. The change interferes with the person's ability to live their life. The interference does not go away quickly and last longer than a typical emotion or reactions that we expected. So in my culture, the Ewe culture, we have different names for anything around connecting to mental health challenge. It's also not any good name. I don't want to deepen the negativity by mentioning those names, but it reflects everywhere. I see the negativity around every discussion as much as mental health is concerned, because that negativity is what we call stigma. When we talk about mental health stigma, is the negative attitudes towards people with mental health challenges or people with invisible disability. So what we are aligning here is, if you understand what is disability and you understand what is invisible disability, then you can easily understand that mental health is not separated from invisible disability, which is what not talked about, which faces a lot of stigma because this stigma can result in people with mental health challenges being treated differently because of their illness. We call them different names because we think that they are going through that, or we think that they have that, and we cannot be part of that. And as I said, it's like the system tells us that no, you are very much stable, or you don't have anything that is not functioning, while disability tells us that any of those things which prevent you from functioning is disability, and some are invisible. So that is also stigma. Now, my question, which I'll test your pulse right now, is if this is so that you understand disability, and then let me start sharing a little. I will give you a quiz quickly. That's the teacher part of me. Just to put this in the chat, recently I developed this. I just put that link in the chat for 1 minute. Click on it, and then we will go through. I developed a framework called the poop analogy framework, which is going wild or viral. I've submitted that in an article, waiting for it to publish, because when I studied across the world, knowing what disability carries is just like the poop that we carry, the negativities around. I'm trying to challenge humanity, trying to question you and I on this platform, that everybody understand what is poop, right? You know what is poop, right? That's it. Poop. It is so nasty. We all have negative connotation around poop. When we talk about poop, nobody wants to talk about it. But how did we arrive here? To know that it's part of humanity. And I'm aligning disability to be embraced just like how we embrace poop. In fact, some of us, our poop gives us a lot of trouble. Some of us, any characteristics of poop, can we reflect a little? We are all carrying it right now on this platform, whether you are rich, poor, black or white, or whatever stratification we give to ourselves, or level or grading, right? And some of us, our poop are watery, some are hard. These discussions, nobody wants to have it, right? We always have it, we carry it, we dress up nicely, we do our polishing, everything. But when poop hits right now, when it knocks at your door, you are going to go to that small room, right? That is how disability is. That is how disability. Then the question is, how come up till now we haven't come to that self-realization as human beings to know that there is something that is challenging our inconsistencies as humans? We can embrace poop to carry it, and we are going with it. It smells so bad. It has so many levels. Some people's own are green if they are taking spinach or iron. Some it is yellow or whatever type it is. And some of us, we go for it to that room in the morning as early as possible, some in the afternoon, some in the evening. That is how arthritis also comes. That is how epilepsy comes. That is how dyslexia comes. Some of us, we grow up before we come out with, or we arrive at what it is. The question is, how is it that this discussion is not part of our discussion tables? How is it that we are not able to think about accessibility? Is it web accessibility structures, or how is it that we don't talk about this in our table of discussion from the beginning when the budget is being discussed? As an employee or as an employer, when we are starting the budget to create, now we know that we have built toilet in every houses across the world. Nobody will say that they don't poop. Nobody would say that they don't have toilet. That is how disability should be discussed across the world. That is the challenge I'm throwing to you, that if you understand disability from the poop analogy, you are likely going to move forward easily to put things in order for your people who you are working with, especially people with disabilities that are very much available for you to discuss with you as an employer, or to just talk to you that this is how I am experiencing my disability. At that point, it doesn't become the person's problem anymore. It becomes our problem. In an African term, Ubuntu, which I will use, or I use most of the time to explain things to people in terms of interconnectedness, or I am because you are. If you know that you have carried the poop and your poop is yellow, or your poop is green, or your poop comes in the morning, when I come to you as an employer, that I have my poop appearing in a different color or size or whatever, we know it stinks. Yes, disability stinks because not everybody has the resources, or not everybody even has the capacity to talk about what they are going through, or not everybody even has the name for it, as I said. But if it becomes poop and we normalize it, and knowing very well that it is part of humanity, we will develop what we call disability pride, which some of us have developed very proudly. And that is why when we get to platforms, we want to empower people to know that you are in need with us. You cannot deny yourself. When you are, one thing that research shows is when you are at the denial stage of yourself, that is self-identity, you are going to go through a lot of trauma, a lot of things, rather than accepting who you are and moving forward. That is a powerful tool. I find, especially as I work with faculty and students in the classroom, I just know that some of us, we lost it from childhood. Yes, we lost it. Our parents, as I told you, my dad said, I'm a useless thing. Our parents made it very difficult for us. Our loved ones, people who are supposed to love us more, made us very much weak. They made us feel that we are the worst thing that happened in the world. But I'm empowering you right now as an employer. As you are going out there, I use the word ambassador. So your ambassadorial work is starting to talk about disability, normalizing it just like poop. If you have that tool, go through those questions, how you understand it, and how I'm challenging you, but I'm bringing you to the realm of disability pride. You are now coming to own your disability. What is going through you right now, I can see it from some of your faces, even though I don't see your faces anyway, but that's the reality, that disability pride is the idea that the people with disability should be proud of their self or their disability identity. So in short, what we are saying is disability is our identity. So we can never nullify it. We cannot erase it. It's like me saying that I'm Black woman and then I'm erasing it that I'm not Black anymore, right? No, it can't happen. That's my identity. So I embrace disability and I love all the capacities that I have. I love everything, but because I understand that I'm not alone, I just know that people around me all have something, but I pity them. I pity them that, oh, I wish they could know that they have this, and that. That's the power that we have. Those of us who have built disability as our pride. And research shows that people with disability are the largest and most diverse minority within the population, representing all ages, abilities, races, socioeconomic backgrounds, or anything you can think about on this platform right now. That is why you and I can do marvelous things to change the negative narratives that the ableist structures have put down. Because when we read history, let's say in America, eugenics was there to destroy all the people that they thought that we are not supposed to live by sterilizing, by injection, by electrocuting, right? Just 2006. Boston, we had a whole building, a whole institution still electrocuting people who have Down syndrome, right? The same thing happened in my culture. We had evil forest. They were throwing people like me in the evil forest for the animals to devour. Those are the things that the ableist structures laid down. It's history. So you and I are dismantling that history. We are making sure that this history doesn't represent or duplicate. You are taking a different route of the poop analogy to embrace disability, to own it, and to move along with what it is. I have this short videos that I'll show you. Maybe I'll show it at the end rather, so that I can finish talking. I'm enjoying this talking myself because we interview some of the people who went through this training of understanding what disability pride means to them, both Africa and European, and they express their views. So I'll show that those videos at the end of the day. And how do you identify early signs or symptoms in people who are going through mental health at your office or in the house or in your community? You know, these are some small signs that because we are naive about what it is which is so close to us, we just take it that it's normal. That when you are having this type of tired looking, this type of unkept dressing or anything like your appearance. In fact, as much as we have cultivated that Ubuntu spirit of being together, doing things together, we have to check on our friends, our workers, our employees, our employers, check on them that how they are doing, which actually is not part of our work anymore because we are all checking the time. Everything is time bound. We are checking the boxes in the classroom, in the hospital, everything that we have to do, we leave those out even for ourselves. So identify the symptoms as I'm talking about the symptom. If you have an emerging pattern of showing up for your friend or yourself, maybe cancellation of personal professional commitment or feelings that are not really I mean that as you know your friend or you know yourself, you're feeling that you are no longer interested in activities or hobbies that you do. Those are some of the signs. Or your thoughts, you're having difficult concentrating or focusing on work or at school or even your children at home. These things we take them for granted. We need to talk about them. They are signs of mental health, and I'm going to walk you through a little bit with the mental health first aiders action plan. These are the algae, as we call them simply. As you watch those things, first we want to empower you to assess for risks of suicide or harm. Studies shows that the word suicide is so heavy on our lips. We are not able to say it at professionals, especially culturally, as some of the cultures that we come from. Let me use Africa as I am, and I work across Africa in most cases. We realize that we cannot ask the question, do you think about suicide? Are you planning suicide? Is there any idea of killing yourself? We will say, no way. Why are you asking that question? But as a first aider, I'm empowering you, or I'm telling you that those questions can give you an open discussion. It is a taboo that we don't ask, but I'm telling you that start asking those questions. When you see those signs of a person, when the person starts asking you or acting weird at office or doing certain things, please feel free and ask this question. That is, you're assessing where the person is in the level of the harm. Listen without any judgment. I'm going to give you some questions and you tell me whether you are being judgmental or whether you are being just friendly as much as you want to help that person, and give assurance or reassurance and information to the person. How do we do that? It depends upon the situation that you find the person and the culture and the relationship between you and the person. The person must be very much available for you to be talked with. If they don't, you have no opportunity to do that. But the other way around is maybe to hand over that discussion to somebody close that you know that can be of help to the person. Encourage appropriate professional help and encourage self-help and other support strategies. Those are the things that we encourage you to do as an employee or employer or mother, father, wherever you find yourself, because this discussion, we want it to be a very neutral discussion. Don't forget, from the poop analogy framework, and bring it here that, well, we're having this discussion not because I'm punishing you to be negative, it's because I have the poop myself, right? And this is the short test I want to give you. And this one, maybe put it in the chat which one you think it's helpful or unhelpful approach. When somebody is talking to you and you are like, I understand and I know exactly what you are going through. I must be very frank. People do that a lot, especially who are the people? The medical experts. We do that a lot. We think that Anybody who comes with arthritis or physiotherapy issue is the same. It's like, I know exactly what you're talking about. No, you don't know. The fact that I'm sitting down in a wheelchair and the fact that you've just treated somebody who is also in the wheelchair, no, my mental health issues are different. So that is where we are now, to judge ourselves, to critically analyze what are we doing to our patients, our clients, our whoever we work with, our students. Yes. What happened to me 2 years ago? Oh, that happens to me 2 years ago, sorry. We compare ourselves to people who come to us instead of just listening. At times, people just want listening ears to be there for us. And that is what first aiders do most of the time. And I love doing that. At times, I don't ask any question. After they pour out, what are you expecting me to do? Or what do you think I can help you with? You know, but not that, oh, yes, I know what you are talking about happened 2 years ago to me. No. I am concerned about you. It's an expression we can use to talk to a friend that, in fact, I am concerned about you. I think we have to talk, because this is not how you respond to activities where we talk about we are going for barbecue, something like that. I'm concerned about you. Let the friend know that you are concerned. You will get over it. You've just got to ignore it and get on with life. Those are some of the expressions that come from experts, or let me say professionals, which are killing us in our environment. Oh, don't worry, you will get over it. You will feel differently tomorrow. Actually, somebody told me that myself. Yes. So one thing I didn't tell you is I have twins. That's why you need to buy my book or read my book. I have twins, and I lost my twin girl when they were 7. And then somebody told me that, don't worry, you have another twin. Can you imagine that? I lost my daughter. Yes. So when I'm talking about these things, I know how to also go through grief and come back, all the 5 stages of grief. I have to connect with that, but not to say that I will have another child, so I won't grieve. I have met people that say that, well, it's okay, but it's not okay. It's such a beautiful day outside. How can you feel so sad? That's an expression from a colleague telling another colleague that it's beautiful outside. You have no idea what that sunlight is going to do to her when they should go out. So you see how we kill our people working with us closely, whether they are subordinates or whatever. But as much as these discussions are becoming part of us now, it will flow neutrally. You'll be conscious, because I will say that we have done all these things unconsciously. And how long have you been feeling like this? Yes, that's a good question. Maybe at times some people don't even know how long they have been in it. Yes. Have you spoken to anyone about this before? That's a good question, because we always suppress it. We always say that people will stigmatize that. We always say that we are not going to form part of that group of people. We don't talk about it. I'm telling you, it's time to start talking about it. And the question is, what can this improve in your life? If you talk about it, what can this improve in today's world? If you talk about it, and what is the real world application for you? As you have heard me this morning, what is the real world for you, that when you sit down in your couch and you are looking at poop carrying the poop you are carrying in your stomach, and Professor Mary is also carrying the same poop, and then Jennifer is having the same poop, and then Marianne, everybody is having the same poop. I think we should start a poop conversation now and rethink about how intentionally, the word is intentionally, how can we go back and make sure that we start conversations that align with ourselves, not like we are going to be solving the problem for those people. No, for us, because whether you like it or not, I am challenging you that you have one of that disability, which might be invisible or even invisible. Now, quickly, let me share. I know I have 1 minute to stop, because I want to give you 50 minutes to ask me questions. But let me share this short video, what the people are saying about disability pride. And then maybe you will be empowered, because for them to get to this level to say some of the things, maybe listen critically to just these young ones. I'll put the second video's link in the chat so that you can hear it yourself. Those are the Africans, these are the Europeans, and for them to get here,
What is
they
disability
went through
pride?
some challenges before they arrive at this. Yeah, what is disability pride to you?
Hey, I'm Amy from the Youth Disability Advocacy Service. Disability pride can mean different things to different people. It can be about embracing your disability, not hiding things about who you are, and it is celebrating the good things about your disability. Nathan, a young, profoundly deaf, hearing impaired adult.
Disability pride means a lot to me because it's a community that I feel included with, and knowing that I'm not alone.
Mary, a young adult sitting with Amelia and Savannah.
I think for me, disability pride is basically not being ashamed of the fact that I have a disability.
River, a teenager.
It's kind of fun having Asperger's. When I was diagnosed, I was sort of like, so this is why I'm different.
She puts her fingers to her temples, then releases them.
I'm just different from other people and I see the world in a different way.
Veronica, a young adult, sitting with Summer, a teenager.
I'm happy to be blind because if I was sighted, I wouldn't have had all these experiences that make me who I am today.
Edie, a teenager.
The best thing about having a disability is kind of the wisdom that comes from it.
Savannah, a teenager.
I have like a view of the world that's like really different. We all had this different perspective.
Zoe, a young adult wheelchair user, talking with Laura, a young adult.
Disability pride is not something that's necessarily easy to attain for every single person. It's a journey, and some days you have a stop where it's like, I'm not proud of my disability today, but tomorrow I feel great about having a disability.
Julie, a young adult of short stature, sitting beside Cindy, a young adult with dwarfism.
It took me like a while, to come to terms with my disability. It wasn't really until I met other people like me and spent some time around them.
Just hearing other people have similar issues to me is just amazing. I felt so good to feel that I wasn't alone.
Sean, a young adult wheelchair user.
When you get a win, when you work it out, you get through it. That's a big achievement. All you did was climb 3 steps in physio, but that's a huge thing for you. It doesn't have to be a huge win like finishing your degree or getting a promotion at your job. It's the little things that you've worked so hard to get to. You need to be proud of them.
River.
If there was like a magical new drug or something that would take away my Asperger's forever, I wouldn't take it because I like who I am, I like having Asperger's, and I would never, ever, ever want to change that.
She crosses her arms and shakes her head. Ashley, a young adult with Down syndrome.
Sometimes I just love to tell people with Down syndrome, don't you limit yourself.
She waves her hand and shakes her head with attitude. Veronica.
Our disabilities are what make us unique. And as a community, being able to share this uniqueness will help society to grow.
So, for them to come to that self-realization and say, if I should have a new drag for Asperger's, I will not change it. It was a long journey. And I know from now, your journey is starting to love yourself, to love the next person around you with whatever disability they have, and to think about how we can collectively, with the spirit of Ubuntu, solve the issues of disability together in the world. Thank you so much. And I am ready for your questions.
Well, wonderful. Thank you so much, Dr. Sefacor. This is terrific. And look at all the applause you're getting with the emojis and the hearts in the chats. This is Marianne Levitsky. I'm the Zoom host. I apologize, I cannot turn on my camera. I'm having some kind of computer problem. But I can allow you to unmute. In fact, I will allow everyone to unmute now. But don't unmute unless you want to ask a question. And the way you can ask a question is you can put something in the chat, or you can raise your digital hand. Possibly if you raise your real hand, I might see you, but I might not. And but I hope you know where the digital hands are. They're usually, most people have them at the bottom with the react function. There's a hand raise. And I think Dr. Sepulchre is open for questions. So thank you so much. Does anybody have a question or a comment that you want to share? Dr. Sepulchre, maybe I'll start off with a question. Could you explain maybe a little more about the certificate you got about mental health first aid, and what does it qualify you to do, and maybe just some of the steps that one needs to do to become a mental health first aider?
Yes, so this certificate, which I want to highlight it again. I like highlighting that certificate. It's a certificate of first aiders that we have to go, let me use the word evangelism. We have to empower people to start thinking, to start talking about this mental health, and also maybe requesting that they see the professionals. And also it is that beginning, is that type of beginning to have this discussion, even not only at their workplaces, from home, from any place that you see any change, or you might not even know the changes the person, have, but if they approach you. So, yes, so it has, it's from the National Council for Mental Well-Being, and I'm certified to work for 3 years and renew, something like that. And yeah, so that is one major additional value that I have, that I can say recommend you to any place that I think you have the resources to start treatment or to start working towards your well-being. Yeah. Have I answered your question?
Yes, thank you. Thank you very much.
Thank
and
you.
yeah, there are more thanks in the chat. Again, if somebody wants to raise their virtual hand, that's good. But if you don't know where to find the button, you can just start talking, because we don't really have people in line to ask a question. So there is a comment in the chat. Marilyn, do you want to unmute and say what you? Otherwise, I'll read it.
Yes, I work as a healthcare professional, and then I've had experience with people with disabilities of various kinds, like cerebral palsy and other neurological disorders, that there could be some mental health overlay. And I'm just expressing what they have voiced to me, how vulnerable they feel in the workforce population, that they have to give 110 or 200% to the workplace, or they will be let go. So I'm just expressing what they're experiencing.
Thank you so much for sharing that.
Are there any other comments or questions that you want to post in the chat?
Marian,
yeah, go ahead.
And Sepulchre, Dr. Sepulchre, I want to voice what I think, and I hope many of us are thinking, which is this is a very new way to think about disabilities and mental health. And it has caused me a lot of thought, and I really appreciate your presentation. And so briefly, I will just share my own small walk in life, which is the first time I had cancer. I was in the workplace. In fact, I had just taken on the job of directing this group. And a person came up to me and said, I know what I would do if I had cancer, and continued the story. And I happened to stand there thinking, I doubt you do. I doubt you know my shoes. You have not walked in my shoes. And so the second time I, I had cancer, I was a little more armed with responses. They were not rude. They were not, they're more along the lines of what I saw in your list of comments about how how you actually get people to think about what they're saying to you. You don't have to come back aggressively. You just sort of um, help them understand. And some people you can't help understand. But I think that's what all these your whole presentation was about is helping people understand they have not walked in those shoes that they see, and they need to be more understanding and find ways to build people up instead of pushing them out of sight. I just want to say thank you for your presentation. Thank you so much.
Oh,
Thank you.
thank you. Thank you for being vulnerable. It's not easy to understand because I don't expect so many questions now. I know people are processing what I just dropped on you. Took me myself a very long journey to get here. So the only thing that I need to do is to empower you to let you know that there will be a time if you doubt, which I'm telling you that don't doubt anymore. Think about you having it, whatever position you have, it doesn't matter. You trying to have that self-reflection now and have the self-realization moment that no, I carry something which prevents me from functioning just like poop. And then you are able to connect with your clients or your community that you work with closely. And with that, when somebody comes to you that this is what my needs are, you will definitely align your thoughts with that person. You will not be thinking that you are over asking, because I see some of our clients or our people that we work with, they are always in pain, because pain in terms of they need some resources to function. For instance, I have different levels of tables, right? That if I am in my wheelchair, I use a different table. If I'm in my power chair, I use a different table. To some people, they will say it is too much, unbearable, because we don't have budget for it. These discussions, even though it sounds very simple, has a deep um, reflection, or what's the word? Deep implications. That's the word. Deep implications on our policies, practices, and then all the things that we'll be doing. So you and I, as 174 on this platform, if you should go with your ambassadorial work of talking about disability openly, with that child who is drooling saliva, who comes to your office, and then you use this. I use the poop analogy I started with kindergartens, and they understood. When they asked me, what is disability? Why are you sitting down? Why are you not jumping? Like how I used this to teach them. It sank very well. It worked perfectly well with them. And I went to the middle schoolers, and I went to the high schoolers, and then the college students and professors. And I just know that when you understand this very well, that community building of awareness, of just thinking openly that how do we do this now? Now we have to rethink. You have to change every way of thinking now to see how best we have to include disability in nutrition, in occupational therapy, and everything that we do. It's part of us. Thank you.
Thank you.
Thank you. Thank you. Thank you, both Jen and Sepakor.
Good evening. Hey.
Alec, sorry, I think there's a question in the chat. I think
Well,
maybe
it's
somebody
morning,
else.
actually.
Oh,
It's
Janvier.
11.
Hi. Hi.
Yeah.
Good to see you. If you have a question, just hold that for a minute. I wanted to ask the question
Yep.
that Alec posted in the chat, and thank you. He thanks you.
If you don't mind,
And-
I'm attending and I'm finishing up another webinar, but in 2 minutes I'll be done.
Okay. Well, we might be done in 2 minutes too.
Okay.
Thank you. Alec asks, what suggestions do you have for organizations to foster good mental health and reduce workplace mental stress?
May I have a comment?
I have a lot of suggestions, but The first thing that I will say is start that conversation because it's a taboo topic to talk about. Because from mental health, we have different names. In the English language, we have very nice way mental health. But when you dive deep into our cultures, as I said in the earlier stage of my presentation, our cultural belief systems influence mental health or disability a lot. I start having that conversation, which name you have given to it. Let's discuss it and decode it. It shouldn't have any negativity. The moment it has negativity, it will have stigma. And that is why it becomes so difficult to work around people. So people might be going through these things, but they will never talk about it because you will label them, because you will not pay them their rights payments, or how do you go pay? Yeah, they will not, you will not give them the right pay that they deserve because they have disability. It comes into all those levels or layers. So beginning of the conversation, you can invite me to come and even start the conversation for you if it is hard on their lips, which is my fun work that I do always. That let's try it. In fact, if it should be in person, we would have done so many activities so that you come to that aha moment yourself. Whether you are the director or the boss or whatever, I know every day, even the president, anytime that these things are done, everybody has that understanding that we need to change our attitude towards disability now. Yeah. Thank you.
Great. Thank you.
I have a comment.
Yes,
If you
go
don't
ahead.
mind.
Yeah, go ahead, Jean-Pierre.
I just love your presentation, and I like the fact you mentioned Ubuntu. I'm from Rwanda. We use Ubuntu. That's, in fact, I thought it was our word, but anything used in South Africa. I reviewed the paper from South Africa using Ubuntu in a workplace, and I mean, it's really wonderful paper. I wish you could write a paper on Ubuntu for, they're trying to outline who you just talked to us about. And I also like the fact you studied in Denmark, and I had my best theologian, Soren Kierkegaard. He said, "When you label me, you negate me." So it is a society, but also yourself. You label yourself, you negate yourself. Somehow, I think it's really, it was a wonderful presentation. I thank for your contribution to what we thought we knew, but I know more than I knew before I attend your webinar. Thank you. Thank you very much.
Thank you,
Thank you for that
Jamie.
comment, Jean-Pierre.
Mhm.
And
I
there's a
just
little
want to
bit.
say quickly that I put the link of my book that's the audio version, because that can work for everyone, in the chat. So if you are interested, yeah, you can hear more in this book. Every chapter, I ask you questions that you have to decode yourself in your bedroom. After reading every chapter, that was how intentional I was in this book. So I would encourage everyone, and share it for people. As you know, you are ambassador of the poop analogy now. You are ambassador of. Thank
So
you.
thank you. There's a bit of a discussion, if it's okay if we go over a few minutes. Alex asks, how can digital privacy particularly improve mental health, especially during this era of fake living online? And Krista had a response to that. I wonder what your thoughts are on that, Dr. Stefako.
Yeah, I think so. I have a workshop coming up on the 19th on the other platform called Coil, what Mary talked about digital accessibility, which is a big discussion also. It is not fake. It's actually, this is the flyer. I can highlight it quickly for you. If you have time, you can also, they posted it on LinkedIn under Coil. Yeah, so what am I saying here? In this digital world that we are, we have to be very much aware of the tools that people with disabilities need, especially as much as CAC is concerned. I don't know how many of us know about that. Digital accessibility has come to stay. And in the US right now, in April 27th, 2027, we will be held responsible or accountable. We will be sued by clients generally wherever we are, and it's so much a problem that most people or NGOs don't know about this. Why? Because nobody talks about disability, right? But let's say people can sue you openly now and have their big money because of the policy. By April 27, everybody has to be the AI inclined or online inclined to meet the needs of people with disabilities. So that is a place that we are now talking about it, checking organizations. Are you really accessible to everybody to everybody that they can go to your website, come to your programs, get your flyers or anything and just say that you have included them or you have excluded them consciously or unconsciously. So yes, I will say that it is not fake living, as Krista said. It's more of the authentic life, which is coming to stay, but we are not well empowered. So we have to be well prepared to meet the needs of everybody across.
Great, thank you. Not about you, this topic, but I did get a question personally to me about certificate of attendance. So I just posted some information about it in the chat. Is there, we're really at the end of the time and we were getting lots of thanks in the chat, Dr. Sefakor. So I would like to add my thanks to you as well. Thank you all very much. And thanks to everybody who participated. If there's another comment or Jen or Mary want to say anything, if not, we can wrap up. So thanks so much.
Appreciate you. Appreciate the presentation very much.
Yeah.
Thank you.
Look, yes, we certainly do. And we will.
Jennifer, can I draw the attention? I just put the WCAG link also in the chat. I know a lot of people are here who will be wondering what's that, the standard or the guide that organizations should be following now. Start that research. I mean, the link is there so that you can dive deep before a person with disability intentionally will go on your website and say, this person hasn't, or this organization hasn't served me equitably. So thank you.
Yes, and thank you. And people may want to know about the slides and the recording. We will post the recording on our YouTube channel, not right away because we do a little light editing. And in the notes on the channel, we will also link to Dr. Sefakor's slides. So you'll have access to those. So with that, I want to thank especially our speaker. Thank you so much. From all the thanks and applause I think you can see that this was greatly appreciated. And I thank everybody who attended and have a good rest of the month. Take care.